And it's action. Good evening, everyone, and welcome to my webinar on MyChart, a brief overview tutorial of the app that I recommend everybody download for their own healthcare. My name is Veronica Blanken, and I'm the Consumer Health Librarian at Greenwich Hospital. For those of you who this is your first time attending one of my webinars and who don't know me or what I do, basically I work at the Greenwich Hospital Medical Library and I help people find health information, whether it be through books, through the internet, just to narrow down specifically what you or they want to search for and to help you make better healthcare decisions as a result. Today I'm focusing on one specific. I'm very narrowing down my topic today on just the MyChart app. Now, you might be wondering, if you have attended my mobile app webinar from a few months back, why I didn't mention this back then. Because those apps were for specific things like weight reduction, stress management, maintaining exercise routine. MyChart should just be an app that you should download immediately as soon as you get like a phone, in my opinion. So because this is essential for just your own healthcare and well-being, and you'll be able to see and understand that as we go through the presentation. And just a heads up, we will be having a Q&A at the end of the presentation. You can use the Q&A icon on the bottom of your Zoom screen to ask questions. And I will be able to send a handout of this PowerPoint to anyone who asks. I will be providing my email at the bottom PowerPoint, the very last slide. So if anybody's interested in any links that are there, I can definitely send you the handout version of this PowerPoint after the presentation. Just a brief disclaimer that I always give before I begin any of my webinars is that this presentation is for educational informational purposes only. As I am not clinically trained, I'm only a librarian. You should always consult your doctor or other healthcare provider for medical advice before making any lifestyle decisions that may impact your health. And also, while I am discussing a specific app, I'm not being paid to discuss it. I'm simply just promoting it for the hospital, so no sponsored content will be featured. So I outlined just a few, sorry about that, I should put my phone on silent. That's embarrassing. So the objectives for today's presentation is to describe briefly what MyChart is, and I'm sure a lot of people have heard about it, especially considering what's going on with the pandemic, and there's more teleservices, telehealth, telemedicine, teleservices, just everything's tele. You probably already know what MyChart is, or your primary care physician has told you what it is, but we'll briefly go over that. And I also want to explain why it is the mobile app that you really need to download, because it is the way of the future when it comes to medical health. And then just briefly go over how to sign up and use it for video calls, which is most likely what many people have already done or are familiar with, but we can just go over and I'll show you a quick guide that you can use to follow up on that. But this is just me as a historian. I have a background in history. I just think when I was researching MyChart, I was just thinking, wow, how far we've come as a society in terms of how the way that we used to keep medical records. I actually found an article online from National Geographic that talked about this, the history of the medical record. And apparently this picture, as you can see, there's the body and all the organs, but they've got what's branching out from there are what seem to be planets. Apparently this is what it used to, when instead of having doctors back then, there were actually astrological doctors who actually determined your health and status and what ailments you had based on the planets that were visible in the sky during that day or month. So that's prior to the 1700s, very, very early human history. This was how medical records looked. This is exactly what they looked like. And around the 1920s, paper medical records were established and used more frequently because it was much easier to see an overview of a person's health over time by keeping records of them from birth to as they get older and older. And in fact, medical librarians, that was the initial role for someone like me, would be to sort through all of these records and keep them alphabetized and organized and such. And then around the 1960s and 70s, when the computer was becoming the main thing, the rise of the internet, and around the 2000s and early 1990s, this generated the electronic medical record, which is shortened to EMR. And because of a 2008 legislation, it is required by 70% of all primary care providers that they must use EMRs by federal law. This is a requirement. So that is why, while you are allowed to get a print copy of a medical record, a lot of the time when you go to your doctor, they're not really writing down notes. They may have a tablet in front of them, or while they do write down notes, they are required later to type those same notes out on the computer, which is why you hear a lot of doctors say that they have a lot more paperwork, even though it's not really paperwork per se. But it's just amazing how the advances of technology have brought us to this. And now we go from the tablets and electronic medical record to having that same access in a tiny box that fits in our pocket. So I just thought that was interesting to go over. This is a nice visual that I found online that displays the patient side and the provider side in terms of how the electronic medical record works. So down here, if you pay attention to your side, you can see the patient downloads and enrolls into the health. mHealth stands for mobile health. But we're talking about MyChart specifically. You can download and activate the patient portal. This is what they call, which is how most places describe MyChart as the patient portal, because you're literally accessing what normally the provider would only have access to. You can share data between your apps, your iPhone's health app, and then the data from MyHealth can now pass to the MyChart portal app. I'm assuming when they mean that, they just mean like, oh, whenever you put in like your payments and such. And then it even says the provider side. So MyChart is connected, is the way that you can getting access to the Epic software, which is what the Greenwich hospitals, for instance, electronic health record system is. So what is MyChart? A free patient portal app. So it allows you to gain access to certain portions of your electronic medical record, or EMR. So what can you do in this app? You can view your test results, you can see upcoming or past appointments, and you can actually schedule those appointments, routine appointments. You can communicate with the doctor or healthcare team, which is what the video visits are for, and also to renew prescriptions. So why is MyChart a really great app to have on your phone? So all of your important health information is in one secure place. And if anybody's seen or attended my previous PowerPoint webinar on what to ask, your role in healthcare, where we talked about what's important to bring to a doctor's visit, one of the things I mentioned was that you should bring your medical record, especially if this is a new doctor that you have not met before and who is not as familiar with your health and your health history as your previous doctor has been. With MyChart, you're able to connect with the doctor electronically, just share all that information digitally, and most importantly, not have it be in the form of papers that you have to find and scramble around your house to look for, because that is the most annoying thing, in my opinion, is just having a bunch of papers all over the house that I did not organize properly. So instead, you just go on the app, and the app is secure. You do have to, when you do sign up for it, you do create a personalized password in it, and that only you know or should know, unless you create a proxy. So, like I mentioned earlier, it's accessible. You have it right in your pocket, essentially, as an app. And the app is free to download, by the way. And because telemedicine has now become the new normal, it's almost become a necessity to have this app in order to do your routine appointments and visits with your doctor, especially since screenings make it difficult, or certain clinics have shut down their physical locations, and the primary care physicians can only be able to see you this way. So a big pro of this is that, as opposed to getting the bill in the mail and then having to mail it back as it was before, or getting the results mailed but having it take a really long time, and nothing makes you more anxious than wanting to know your result, right? Especially when it comes to COVID testing. I could not wait the initial 5 days that they told us about. It was too nerve-wracking. But with MyChart, it's actually a lot faster. Delivery of both results and the payment method. You just put in the payment information and it's all done in a split second. And while not every single primary care physician will be using MyChart, most YNHH or Yale New Haven Health primary care physicians do use it. And in order to make sure that they're on it, most of them will tell you an activation code if you visit them or when you call the office, or you can request one yourself, so that you'll be able to. This is for people, by the way, who do not have MyChart yet. You need to have an activation code in order to activate MyChart when you first sign up for it. So that brings us to the next slide, how to sign up for MyChart. So this is when you actually go into MyChart. This is what it looks like for Yale New Haven Health. Make sure that it says the right hospital on it, because every hospital has its own MyChart sign up page. So you want to make sure that you're in the right hospital and you're signing up for the patient portal for that specific hospital where your medical record's located. So as you can see just on this page, it tells you some of those things that we talked about that MyChart provides. It provides video care. I actually have a link for this video visit quick guide that we'll be going over later in the presentation. You're able to communicate with your doctor from the comfort of your own home, whether it's by video or messaging. You request prescription renewal. When you tell your doctor exactly where your pharmacy is located, they'll be able to just do it with the tap of a button. This is a neat little feature, which is to access a family record by proxy, so that you have a child whose medical record you want to keep track of, or you have an elderly relative who you want to keep track of their health, help keep track of their health as well. You can be a proxy and have an account that's you can access as well for them. And then the video care on demand, so that you can go to the primary care through your mobile device via video visit, access your test results, and lastly, to pay your bills. And I should have mentioned this earlier, but they specify this in almost all of the literature on it, that you should really not use MyChart for any urgent medical matters. Definitely contact, if you have a heart attack or something more serious, definitely call 911 or contact the doctor's office directly. Yeah, MyChart should not be used for any urgent medical attention. So I won't be going over how exactly to download the app and how to configure your password and such, but Yale New Haven Health has provided a really helpful video through this link on Vimeo. So it's only 6-7 minutes. So it tells you how to download, configure, and use for the Apple phones, those of you who have iTunes and such. And then they have a separate video for Android users. Although I think the only real difference is just how you get to the Apple Store when it comes to Apple and Android. So those two videos are there and those links. If anybody wants me to send those links directly, definitely let me know by email. So tips for video visits. Because we're in the midst of a pandemic, and like I said, a lot of these clinics may not offer in-person services because they want to limit exposure. Telehealth services and televideo has become the new norm. So whenever if you're thinking about what type of appointments justify a video visit, it's these ones: new patient visits, follow-up visits, post-op visits, visits to manage your medication, ongoing health conditions, and just general education on a specific condition. So this is a really short video that I found on Greenwich Hospital's website when I put in MyChart, but she explains it a lot better than I could. So I'm just gonna play this, and here we go. Just 2 minutes.
Hi, nice to see you. Did you have any troubles hooking up today on the video? There are two variations of telehealth services. There's phone visits and video visits. We prefer video visits because you can see people in real time and they can point to what hurts or they can show you what's really bothering them. The way they do it is through their MyChart app. Our staff has become very savvy at getting patients hooked up onto MyChart, and then they need to download the app either onto their iPhone, their Android, their iPad, their tablet. There actually are instructional videos that we can send to patients to help them do that. And then once the visits get scheduled, it appears in their app, and they can just push on the button at the time of their visit, and I push on the button on my phone at the time of the visit, and we enter the virtual room together. If people are extremely short of breath or having significant chest pain, patients who know they have cardiac problems, are having symptoms classic for heart attack or stroke, those folks should still be calling 911. I think that it's important to remember that we just have to be creative and adapt, and that things that may seem unusual have to become usual, and that it may take a little bit of extra work, but it's really worth it. And that on our end, it may mean we have more questions to ask you, and we may make you stand up and sit down and move your leg, and we just have to really work together to provide good care. And we always really had to work together, but this is just really a physical example of that.
So very well put. I think this video pretty much explained a lot of it in terms of video visiting, and what the purpose of it is, and how, despite the obstacle that the pandemic has put in our medical lives, we can still overcome with the help of the technology we have at hand. I think what I should have mentioned earlier was that you can actually access MyChart, via the internet, like it's its own site, and do it on your tablet or whatnot. But I think video visits you can only do on your iPhone. So and some people are like way less comfortable when it comes to using their iPhone when it comes to video. I still have issues talking with my parents on FaceTime because sometimes they don't know exactly how to position the camera so that I can see their entire face and not just half of it or a quarter of it. So I actually found Yale New Haven Health's video visit quick guide. So I'll just quickly put that up here for you to see. So as you can see, your preferred Apple or Android smartphone or tablet. You can prepare your visit for this way. They actually tell you how to download the MyChart app, so that's helpful. So on the day of your visit, make sure that you turn on your microphone speakers, turn up your volume, and then turn off the Bluetooth, except for a medical device. And it actually tells you step by step where on the app to actually do it, the e-check-in. And right before your video visit, it even tells you, how to begin the visit, join by Video Connect. And it'll just it's very, you just have to do it a few times. That's what I say to people when they use technology. That's practice makes perfect. It's an idiom that's lasted for years and it applies to this technology as well. As frustrating as it can sometimes seem. So I had to look around a lot for this guide. I don't know what it is with the Greenwich Hospital's website, but sometimes when you look for something and it should be there, it's not, and you have to look around constantly for it. So if you want to save a lot of time and you want this guide, just ask me and I'll email it directly to you, because I don't know why it took so long to find it, but I don't know why it's not readily available. So this is one of my quicker webinars, but thank you so much for attending. I know this is late and we all have a lot of other things to do, so I really appreciate you all attending. This is my contact information, Veronica Blanken. You can reach me at this number. This is my email, and I am open to both virtual through Zoom or in-person appointments from 9 a.m. to 4 p.m. Monday through Friday. And I do have another webinar coming up next week on where to find Alzheimer's resources online. Please go on the Greenwich Hospital website, events, or call this number to register. And this video, thanks to Al Cusano, is being recorded, as are all of my webinars. So if there's someone you know who might need an overview of MyChart or who wants to look at any one of my other webinars, I do have a website that I can quickly show you that I manage. I don't have the videos up yet, but I'll just show you what my website is. It's the Dr. Stephen Mickley Community Health Resource section. If you just type that directly into Google, you'll be able to access it. So all of my programs are listed here. As you can see, the next one is November 17th, same time, 6 to 7 p.m. I need to update this, those already passed. But there will be a separate tab for my videos once all of them are edited down and recorded. So I think that's about it. How about, does anybody have any questions? Again, you can use the Q&A icon on the bottom of your screen. I'd love to answer any questions if there are any. From Arlene, Gary, Jane, and Linnea. No questions? I'm happy to stay. Not too long though. But a lot of this is self-explanatory, so I understand if there are no questions. Oh, here we go. I see somebody asked a question. Oh, you're welcome, Gary. Appreciate it. I don't actually, I used to have webinars much earlier in the day, so I actually didn't get this much attendance. So I think this time at night, I'll actually get more people. So I guess if there are no other questions, I can just reiterate that, again, if you have any health information requests, such as information about medication that you're taking, or if you want to know how to prepare for an upcoming surgery, or if there's a condition that you or your family is going through, or even information on COVID-19. I recently did a webinar on COVID-19 resources and updates. Definitely reach out to me. I am free and reliable resource at Greenwich Hospital, and definitely want to help you guys out. So if there are no more further questions, I think we'll conclude for the night. Thank you so much for attending, and if you definitely want to learn more about how to find Alzheimer's resources online, definitely tune in next week, next Tuesday, same time, 6 to 7 for my next webinar. So have a good night, everybody.